Medical concerns. This is a response from Dr. Jack Levine as a result of an interview in 2005 related to the medical issues he felt were of most concern to understand when thinking about children with disabilities. Jack has been in private pediatric practice for 18 years, specializing in developmental pediatrics, and has been the medical director for the Henry Viscardi School in Long Island, New York for 17 years. He is a fellow of the American Academy of Pediatrics and a member of the Society of Developmental and Behavioral Pediatrics. He attended Albert Einstein College of Medicine, including a fellowship in developmental pediatrics. He did his residency at Long Island Jewish Hillside Medical Center.
Well, I think to start off, we need to talk about the new definition of kids with disabilities. And now they're referred to as children with special health care needs. And this slide is from the new definition from the Maternal Child Health Bureau. The definition was developed recently in 1998. I'm just going to read it, although you can read along with it. But children with special health care needs are those who have or are at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required by children in general. So that the definition has been expanded to include, many kids that are vulnerable and who have increased medical needs. Essentially, it includes children with chronic medical conditions and children with developmental disabilities. The children with chronic medical conditions are, as you can see, hemophilia, asthma, diabetes, kids with cancer, sickle cell anemia, congenital problems like cystic fibrosis and heart disease, HIV, which is very important, inflammatory bowel disease like Crohn's disease or ulcerative colitis, arthritis, and renal failure. And the other group are kids with developmental disabilities, which I think we're going to be talking mostly about, kids with pervasive developmental disorder or autism, mental retardation, sensory impairment such as being blind or hard of hearing, cerebral palsy, spina bifida, and epilepsy or seizure disorder. There's a tremendous number of children in the United States with special health care needs. And the latest, from the latest survey, the national survey, which was done in 2001, is that there's 9.4 million children in the United States. That's 13% of all children, which is an unbelievable number. And if you think in terms of them being more vulnerable to many things, including child abuse, victimization, whatever, it's an overwhelming number of kids. The Maternal and Child Health Bureau keep most of these statistics, and this national survey of children with special health care needs is available on the internet, and I think is going to be included in the bibliography, and is a really fascinating resource for anyone who's interested. In New York, which is what we're talking about, there's over 500,000 kids that are in this category. 12% of all children, which is like the number in the United States. 18% of all families, almost a fifth of all families, are affected with children with special health care needs. About 2 to 4% of kids have severe illnesses which interfere with the usual activities of childhood. So while, mild or moderate asthma may be considered a special health care need, still a tremendous proportion of kids cannot pursue their normal activities because of their disabilities. That's 150,000 kids in New York. And a smaller group of kids are dependent on medical technology, and we'll talk a little bit more about that later. That's 1 to 2 per thousand, and those are the kids who are, dependent on medical equipment, who see doctors on a constant basis, and that's a small percent. Interestingly also is that these kids, while they may be vulnerable to child abuse and other things, they also have tremendous financial stress, and 20% of all children with special health care needs are living below the federal poverty level, which is, kind of a double shot, because not only do they have medical problems, but they don't have the wherewithal to treat it appropriately. This is some information from that survey on the challenge to health care in New York. But let me just preface this by saying that if you looked at access to schooling, access to religious services, recreational activities, anything, social work services, mental health services, anything at all, you would find very similar problems because kids with special health care needs have trouble accessing any of the services that most of us take for granted. As far as health insurance goes, over a third of kids with special health care needs are underinsured. Now, these are the kids who need it the most, and 11% had no health insurance at all within the past year. 10% do not have a personal health care provider, and almost 10% rely on the emergency room for their regular care, which is pretty shocking considering these are the kids who need the most care. At least, over 10% have at least one unmet medical need, and a quarter of them have trouble getting referrals to see physicians, which is very sad and shocking, and just a statement as to the kind of trouble that these families and these children have. So that's basically an introduction to these kinds of kids. I think as far as why they're problematic, because most facilities, whether it's medical, schools, law enforcement, whatever, do not have a lot of knowledge and experience with these children. And it's understandable. They are rare, essentially rare. If you look at the statistics, children with ADHD or learning disabilities, who are very common, that's 150 per thousand. That's like almost up to 15%. And learning disabilities, 7.5%. Mental retardation, which is 2 to 3% of the population, is still fairly the kind of thing that most people will run into. When you start to look at things like cerebral palsy, you're talking about 2 per thousand. That's very rare and unusual. And as you go to the more uncommon disorders, they become 1 per thousand, like spina bifida, and children with Duchenne's muscular dystrophy, 0.03% per thousand. So that it's not unexpected that institutions don't have much experience with these kids. There's not a lot of information about them, and every one of them is different. So even if you know some kids with cerebral palsy, some kids with Duchenne muscular dystrophy, they may be totally unlike the other kids that you know. So that it's hard for, whether it's hospitals, schools, religious institutions, recreational programs, whatever, to deal appropriately with kids like this. And as if that wasn't enough, there are a multitude of complex problems that go along with all these disabilities. So, the disability kind of stands, and then associated with the disability are many, many problems, which I tried to summarize here, which include cognitive delays, so that you could have a child that has a physical disability and they may not be as cognitively advanced as other children. They may also have trouble figuring out what to do. They may have trouble answering questions. They may have trouble in school. They may have trouble talking, putting their thoughts into words, which then make it even harder for them because they also have the physical problems as well. Another very big problem is toileting issues, and everyone kind of takes that for granted. But, many kids with disabilities have trouble going to the bathroom for whatever the problem, which then influences a lot because it's a normal developmental milestone that many of these kids are unable to pass through, and it's embarrassing. There's hygiene issues. Many, when they get nervous, need to go to the bathroom immediately. So in an interview kind of a situation, they may be, thinking, I'm afraid I'm going to have an accident. I'm afraid I'm going to have an accident. Some of the kids, when they laugh, have accidents. So it makes for a very difficult lifestyle for many of these kids. Particularly, this is true in spina bifida, cerebral palsy, and many of the other physical disabilities, spinal cord injuries, and things like that. Seizures. If you have any kind of brain involvement, you're more likely to have seizures. Which then means you have to take medication for seizures, which means you could have side effects from medication, which could make you drowsy, slurred speech. Many people, after they have seizures, appear to be intoxicated. Many times it can be mistaken for drug use. One other point about seizures is that many people, either right before they're having the seizure, during the seizure or after can be confused or appear to be confused. And you need to know that when you're interviewing them. You might want to give them some time to recover or continue the interview at another time. Behavioral and emotional problems, which I'm going to talk a little bit more, are much more common in children with disabilities. Whether it's attention deficit, impulsivity problems, problems paying attention, focusing, anxiety, depression, anger control. And we're going to talk a little bit about that, particularly in kids with cerebral palsy and traumatic brain injury. Orthopedic problems kind of go along, whether it's scoliosis, hip dislocation, and then what that means is that the kids have to go to a lot of doctors, and they have pain, and then they have to have surgery, and then they have pain from surgery, and they miss a lot of school, and they miss a lot of activities. And, you know, especially when they're younger, sometimes they need to be separated from their parents when they're in the hospital, and then they can have issues with, you know, separation and things like that. Other medical problems include pulmonary issues, kidney problems, stomach problems, things like that, which, you know, oftentimes are more problematic than the disability itself. Another thing I want to stress is sensory impairment. You need to be very careful with kids with disabilities because many of them have vision and hearing problems. And the incidence of vision problems in children with cerebral palsy could be up to 20%, even more. And with Down syndrome, which is a form of mental retardation, hearing problems can be, you know, 20-30% of the kids have hearing problems, if not more. So you need to be very careful if you're interviewing or interacting with children that have disabilities, that you have a pretty good handle on what their vision and hearing capabilities are, because you wouldn't want to mistake you're not answering questions or they're not paying attention because they have sensory problems.
Before we go on, it seems that students with disabilities who have complex problems encounter many different people in their life. Many people handle them. That's what I'm hearing. Does that seem to be a problem?
Well, that's a really, really good point. Many of these kids, and I think we'll talk a little bit about that when we talk about some psychosocial issues, they can't do for themselves. So they need people to help them. And that means that people tend to work 8-hour shifts, except for parents who work 24-hour shifts. But, so you're talking, if a child can't take care of themselves and they need someone to take care of them, you're talking about quite a few people who might be involved with them. 2 or 3 shifts a day, plus people go on vacation, plus different personnel in schools and in different settings. So a lot of people touch the children. A lot of people feed them, change their clothes. And as far as medical personnel go, they see many different doctors and they see many different people. So, that's one of the vulnerabilities that these kids have, is that they are exposed, and they are some of them are very much helpless. On the other hand, they have to learn how to deal with other people, and sometimes they can be very withdrawn and quiet and may not speak up. They're afraid in many ways that people who are taking care of them might not take care of them anymore if they make them mad. And that's a very, very common problem that we see. And one of the things that needs to be done is to have these kids and people with disabilities advocate for themselves better. And, and everyone who's involved in the field really realizes that most of the kids are kind of passive and they may not speak up, and, an incident might happen that you might not hear about for weeks. And then all of a sudden something happens and it triggers them to talk about it, and then everyone's like, well, it was weeks ago. But it's a very, very good point, because they are very dependent on other people. Okay, so for example, you might have a child with Duchenne muscular dystrophy, which is, for Jerry's kids, the kids who... It's a congenital X-linked recessive. It's carried by the women, and only boys have it. And most people think of it as essentially, kids are in wheelchairs and they're very weak. And that is true. But the things that oftentimes are the biggest problems, and not so much the muscle weakness, but the contractures, the muscle contractures, which make positioning very difficult. And then you get skin breakdown and the scoliosis or curvature of the back, which is a very, very difficult problem for kids with muscular dystrophy. And most of the kids develop significant lung disease, pulmonary disease, and heart problems, because the heart is a muscle that is affected, and the kids go on to have heart failure, and they'll be on, heart medication that only older people usually take. They need all kinds of medication for their breathing, and then, that the kids start feeling kind of scared that they can't breathe well, and that becomes most of the time the biggest problems with muscular dystrophy is all of these other issues. And being overweight is a very big problem, which then compounds all of these things. So you can see that, even though you have muscular dystrophy as the primary problem or muscle weakness, there's so many other problems that go along with it that they're very complicated situations, hard to figure out in one meeting. It's very hard to see exactly what's going on and what the major issues are. Another example is cerebral palsy. Cerebral palsy ranges from one limb being affected and basically being able to walk and do almost everything, to being totally involved in all four of your limbs and totally dependent on people. And when you look at cerebral palsy and kids with cerebral palsy, you can see that the other problems that they have are often more important. Like, for example, mental retardation or developmental disability, cognitive impairment. I mean, most of the time, that's the defining characteristic. If the child has a normal academic capability, they can go to school, they can probably go on to be, fairly independent, productive adults. If they have their intelligence being below normal, they're going to be, fairly dependent on other people, and then the fact that they have physical disabilities is going to make that much worse. And if you're confronted with someone with cerebral palsy, it's hard to know. Now, you shouldn't assume right off the bat that they have, cognitive problems, because, probably, like you can see, it may be 30 to 70%. 50-50 is what I usually say. But on the other hand, you need to be careful that you're not talking to them in a way that they can't understand. And on the other hand, a lot of kids with cerebral palsy have slurred speech or speaking problems. And I'd say most people who don't have experience with kids with disabilities assume that someone with slurred speech is not smart. I would say that's, in a social setting, you usually assume that they're drunk or impaired with substances. In a non-social setting, you usually feel that they are not smart, which is often not the case in cerebral palsy, and you need to be careful about that. Language learning disabilities, a lot of the kids have, it's probably more than 40%, which means practically that if you're saying stuff, they may not be understanding it the way you're saying it or the way other people that you're used to dealing with understand it. Behavioral issues, we talked about attention deficit and depression, anxiety. Visual impairments, we discussed. You need to be careful. Hearing impairment, we discussed. Somatosensory problems are really just the way the child positions themselves in space and sees their limbs in space, which probably, as far as this discussion, isn't all that practical. But some of the kids have trouble getting dressed because of it. They have trouble doing schoolwork because of it as well. Seizures, we talked about. A lot of kids with cerebral palsy have seizures, growth failure, and many other health problems, including saliva control or drooling, which, again, most people who see kids who drool think that they're cognitively impaired, which is not necessarily the case. And toileting problems we talked about. In cerebral palsy, it's mostly kids who have trouble controlling their bladder, and they might have accidents, or they might be afraid of having accidents, and many of them don't do certain things because they are afraid that they might have an accident in public, and most kids don't like it.
Okay, so before we go on, it seems that we have to be careful to distinguish what is the primary disability when someone calls or asks. For example, many times people will call and say, I'm looking at a kid here who has mental retardation, or the paper says here he has cerebral palsy, or he is deaf. But what does that really mean? And maybe before we can see that person or really understand, we have to really understand what the primary disability is. Is that right?
Well, see, the terms like cerebral palsy, mental retardation, they essentially are meaningless. It's like they put you in the city, a certain city, and then It's like being dropped off in New York and someone says, well, now you're in New York, you know. I mean, it's what part of New York are you in? What part of the city are you in? What kind of stores are there around? Where do you want to go? It's the same thing. I mean, if someone says that the child is mentally retarded, essentially that means they've scored below a certain score on an IQ test. If they tell you the child has cerebral palsy, it means that they probably have a significant amount of trouble with control of their muscles. More than that, it's hard to say, you know. Cerebral palsy is described in different ways, but, you know, what I think involves the upper and lower extremities, to one person, they may say, well, it's only the lower extremities. So it's very, very important when you get this kind of information that you get a much better description of the child. You know, and hopefully from this talk, you'll know at least to maybe ask about, if they say a child with cerebral palsy, you might ask, well, what kind of school do they go to? Are they in a regular class? Do they have seizures? You know, what part of their body's affected? How's their vision and hearing? You know, things like that. And if you just write down the things that I have on the slide, you know, those would be, you know, some of the questions that you might want to ask. Do they have lung problems, heart problems? So then you get at least a feeling for the kind of child, because the terms, like you point out, are not particularly helpful. It's really more the child, and every child needs to be dealt with as an individual.